For more than a decade now, electronic health records, or EHRs, they came with this huge promise: more efficiency, better accuracy, and most importantly, more time for patients. But that promise, it was completely broken. Instead of liberating clinicians, EHRs actually became one of the biggest sources of frustration and burnout in all of modern medicine. And the scale of this problem, it's just staggering. A major study found that for every single hour a primary care physician spends face-to-face with a patient, they spend nearly 2 additional hours on EHR tasks. That's a 2-to-1 ratio of screen time to patient time. It's a total flip of what medicine is supposed to be. And it's not just about the time, It's the sheer mind-numbing volume of tedious clerical work. Get this. Some analyses show physicians are clicking a mouse over 4,000 times in a single shift. It's like this digital death by 1,000 clicks, and it's taking a massive toll on the very people we trust with our health. So, this all brings us to the central, kind of ironic paradox of the modern clinic, the EHR burnout crisis. How did a tool that was designed for efficiency become a primary engine of exhaustion?
And that's not an exaggeration, not at all. The data is crystal clear on this. The administrative burden that these systems place on clinicians is a leading cause of emotional exhaustion, job dissatisfaction, and it's even pushing talented professionals to leave the field entirely. The very tool that was supposed to help became the biggest obstacle.
Okay, but this goes way beyond just doctors being frustrated. The stakes of poor documentation are incredibly high, creating some really serious clinical, financial, and safety risks that honestly affect every single one of us. Think about it. When a doctor's brain is totally overloaded with clerical junk, patient safety is what suffers. This documentation fatigue leads directly to things like missed abnormal lab results, diagnostic errors because a physician gets stuck on their first idea, and inaccurate medication lists. And we're not talking about small administrative slip-ups here. These are real, genuine dangers to patient care. This whole situation has given rise to something clinicians grimly call pajama time. Those hours they spend at home after an already long day just trying to finish their charts. Over 70% of outpatient doctors are doing this. And the really scary part is, documenting hours after an appointment doesn't just burn doctors out, it also dramatically increases the rate of errors. And on top of all those clinical risks, there's a massive financial hit. Simple gaps in documentation, like forgetting to note part of an exam or not fully justifying a medical decision, can lead to undercoding. The crazy thing is, this doesn't mean the work wasn't done. It just means it wasn't documented right. And for just a single practice, these little errors can easily add up to hundreds of thousands of dollars in lost revenue every single year. So right in the middle of this crisis, a totally new kind of tool has started to emerge to tackle this problem head-on. It's called Ambient AI, and it really represents a fundamentally new way of thinking for a new era of medicine. Now, I want to be really clear. This is not just a souped-up version of that old speech-to-text dictation software. Traditional tools need a doctor to actively dictate, often using these rigid, clunky templates. An AI medical assistant is a whole different beast. It works like a real-time intelligence layer, passively listening to the natural conversation, and this is the key part, it actually understands the clinical context. So how does it actually work? Well, it basically boils down to 4 key steps. First, there's ambient capture, where it just listens and pulls out the key data from the doctor-patient conversation. Second, it synthesizes all that data into a perfectly structured clinical note, right there in real time. Third, it acts as a clinical co-pilot, flagging things that might be missing or potential gaps in care. And finally, it automates workflows by suggesting things like orders, billing codes, and follow-up instructions. And look, this isn't just some theory on a whiteboard. We are actually seeing a revolution in how clinics work, and it's all backed by hard data showing dramatic improvements in time savings, accuracy, and, you guessed it, a reduction in physician burnout.
All right, so the first and most obvious impact? It's time. Study after study shows that bringing in this technology cuts documentation time by 30 to 70%. I mean, that is a huge chunk of the day just handed back to the clinician.
Let's put that into perspective. Primary care physicians are often reporting that they save between 40 and 90 minutes every single day. That's not just a few minutes here and there. That's literally the difference between a doctor going home on time to see their family versus another hour and a half of that dreaded pajama time. And what's so cool is that this isn't a one-trick pony. This tech is valuable across all sorts of specialties. In cardiology, for example, it can automatically pull out those nuanced descriptions of chest pain.
For an orthopedist, it captures the exact mechanism of an injury and range of motion numbers. It gets the very specific, detailed language of each field, which cuts down so much on manual data entry.
Okay, so saving time is great, but what about accuracy? Well, the gains there are just as significant. Notes generated by AI show a 25 to 45% drop in incomplete documentation. This hits right at the heart of those safety and financial risks we were just talking about, making sure notes are more complete and coding is more accurate right from the get-go. And for bigger practices, this can mean a 10 to 15% increase in capturing the appropriate codes. And again, let's be clear. This isn't about squeezing more money out of the system. It's about getting credit for the complex work doctors are already doing, which prevents huge revenue losses from undercoding. And all of this, it brings us right back to the human element, to the doctors themselves. When you take away these relentless, soul-crushing clerical tasks, physicians report feeling less emotionally exhausted. They talk about having a better work-life balance and just more mental space during patient visits, all of which is a direct counterattack on the burnout crisis. So this all leads to the big question, right? The elephant in the room. Is AI coming to replace doctors? And the answer, from everything we're seeing, is a resounding no. The future here is all about partnership, not replacement. The reason why is actually pretty simple, and it all comes down to this core idea of clinical reasoning. This is that uniquely human skill of interpretation, of reading between the lines in a situation that's always changing. An algorithm is fantastic at structuring data and spotting patterns, but only a human can perform that actual nuanced reasoning. And this really sums up the new model perfectly. AI handles the clerical work, physicians handle the clinical work. It's a super clear and frankly, a much smarter division of labor. And believe me, this partnership is just getting started. Right now, the tools are focused on documentation and workflow, but in the next 2 to 4 years, we can expect them to start offering predictive suggestions for things like diagnoses and care plans. And looking even further out, they'll become these fully integrated tools for managing the health of entire communities. And because of all this, these AI assistants are moving really fast, from being a nice-to-have luxury to becoming the new standard for efficiency in healthcare. Doctors get their time back, patients get more focused attention, and the health system gets the accuracy it needs to work properly. It's tech that finally lets doctors get back to practicing medicine, instead of practicing data entry. Which really leaves us with one big and pretty hopeful question. Is this finally the end of pajama time for medicine?